Hi, my name is Julia, and this is my persuasive speech. So the topic I chose to talk to y'all about today was physician-assisted suicide. This topic I have been researching since my English 1301 class, about 2 years ago. I had to write a paper on it, and I honestly chose it because the list that my professor had given me of ideas, this one was the only one that interested me. And ever since then, after that class, in my English 1302 class and my other speech class, I always use this topic. I always use the original research that I had found and just kind of updated it as time went along, added more details, added different things to it. So that is why I decided to talk about it today, because it's something that I have researched and put time and effort into finding more information about. You might be thinking, well, why should we care about physician-assisted suicide? Why does it matter? This topic isn't publicized. People don't really talk about it. You don't really hear much about it on the news or social media. One, because it's illegal. It is only legal in 6 states, and they have strict rules and regulations in those states on how a patient who must be terminally ill, how they go about in requesting to be, to have a physician help them in, essentially, it's dying. I know the first state that actually legalized it was Oregon, and then it just kind of progressed from there, slowly progressed onto different states. So I believe that physician-assisted suicide should be legalized in the U.S. because it not only shows mercy to the patients, it shows compassion to people with a terminal illness. It gives them control over their course of treatment after they have exhausted all their options, and it also lets the doctors safely help their patients with this type of, I don't want to say procedure, but it is, ultimately a procedure, without having to jeopardize their jobs, their medical ethics, or just the safety of the patient and the safety for the doctor. So you would be surprised that over 1,500 people die a day from a terminal illness. You would think that number would have gone down exponentially since, the advancement of our medical technology and researchers finding cures to different diseases, disorders. But that number has stayed pretty steady, pretty consistent over the years, and it actually just kind of slowly increases as the years go on. But the first thing I wanted to talk about was the compassion part, the mercy part. People really argue the side against it, saying that this aligns with, murder. Essentially, what the physician is doing is murdering his patient, and that's not what doctors believe in. They took the Hippocratic Oath, and one of the things that is first drilled into their brains is the do no harm part, and they think that physician-assisted suicide is just kind of going against that. And one of the sources, wrote in his article that physicians do not fulfill the role of killer by prescribing drugs to hasten death any more than they do by unplugging their patients from life support. Patients have, or usually terminally ill patients have, an advance directive, which states how they want their course of treatment if something were to happen to them, if they couldn't make the decision for themselves at that time. Typically we see it's the, withdrawal from life care, unplugging the vent, stuff like that, like extenuating circumstances, stuff like that. So there's not a difference. The doctor is just fulfilling their patient's wishes. It's the same thing as if I was disconnecting life support system and if I was giving you drugs to help you die. The doctor is just going by what the patient wants and is going to do what's in the patient's best interest. And this goes next into the autonomy part, the control part for the patient. These people have been suffering all their lives, more than likely, from something that probably does not have a cure, from something that is debilitating for them both physically and emotionally, and they just want some type of relief, some type of just anything to take it away, especially if they know that there isn't going to be a medical advancement for what they have anytime soon. And this, like I said, the doctors align this with murder, and it's not. There's a difference. Murder is when somebody takes the life of somebody when they know they wanted to live it, versus a person who has a terminal illness. They know that their days are short. They know that their days are going to be filled with suffering and with pain, and they don't want that. And that's why the autonomy part comes in, why they should have the choice or the chance to be able to have physician-assisted suicide as an opportunity if they decided that that's what they wanted. And this goes into the doctors, play in this. A lot of doctors do not support this. Like I said, it goes against their Hippocratic Oath and what they believe in, but the doctors who do support it, they are more than likely afraid. They're scared because this not only jeopardizes their personal ethics and what they believe in, but it is illegal, like I said. And there are different strict rules and regulations on how to follow this, and they do not want to be put in the position where they have to perform an unsafe or dangerous procedure on their patient, because that isn't what they're there to do, and that isn't what they want to do, which is why it needs to be legalized, because it gives them the ability to help them, like I said, to their best ability, the way the patient wants to be helped. And there isn't anything wrong with that, especially if the patient is consenting to it and the doctor is consenting to it. And we shouldn't have to, us people being well, that don't have the disease, don't have a terminal illness that is consuming our lives, we don't know how they feel. So it shouldn't be our decision to tell them why they should or shouldn't have the opportunity to choose physician-assisted suicide. And that's what I think. So yeah, that's my speech. Thank you so much for listening, and have a great day.